Okay, well, wow, already tongue-tied. Welcome, Dr. John, to the Biohacker Babes podcast. It's 8 p.m. for you. We're so grateful that you're here in your evening.
Thank you guys for having me. It's my pleasure.
We're super excited. You are a biological dentist, and I think most of our audience knows what that is because our dad is also a biological dentist, but there are not a lot of you in the world. So we feel it's really important to make sure that people not only know what that is, but also to maybe even encourage other dentists to adopt this way of practicing and inform the average, health consumer and advocate. This is really some essential stuff that a lot of us haven't been taught. So we're really excited to share you with our audience today. But I'm so curious because you talk so much about how disease starts, or is it at the very least connected to the mouth? And because it's not a very popular profession, we want to know, how did you get started with biological dentistry? Did you go through conventional dentistry first? Like, what was your path into this?
Yes, I studied conventional dentistry like everyone. This is the entrance card. And I was always missing something in dental school. I didn't know what it was. I was very good with my hands, and that was the easy part for me. Um, at the same time, I had struggled with a lot of health issues very early in my 20s. So at the same time of studying, I tried to starting to optimize my health already in my early 20s to just get me out of the, like, let's say, out of the hole back again. So I was learning nutrition and supplements and all these things parallel to university, where you also study chemistry and biochemistry, but I didn't really connect it to that I will maybe use it later as a dentist. But something was missing, and I only realized in the residency after dentistry when I became a surgeon that a missing link for me was to help patients get healthy overall, because this is not taught in dentistry. Dentistry, conventional dentistry is a very high, as you know, guys, from your dad, it's a practical thing. You have to be good with your hands manually, but it's basically just to repair teeth. It's kind of like the garage for your car. You've what people oftentimes say is the drill, fill, and bill business, which is sad, but that's how it's seen. And yeah, basically, teeth are seen as biting instruments and maybe for aesthetics and obviously pain treatments and stuff, and hygienes, but that's about it. So there's nothing about chronic health issues. But I discovered very soon that this is the missing link, because in that residency, the surgeon that I was learning from, he was a very great surgeon, but an old school dentist. So he would still place amalgam fillings, which are these, I find, ugly looking silver black fillings. And I told him I cannot do this from an aesthetic point of view. And I was also remembering my dad is a dentist too, that he would not place them for whatever reason. So I started to search for amalgam, toxicity, mercury, and realized, oh, wow, there's a huge rabbit hole. I went down to it and basically started to remove all the metals safely, started to incorporate nutritional teachings and supplementation, all these things to detox my patients, because I was thinking that, or I thought mercury detoxification and heavy metals is the holy grail, which is not. It's just a part of it. So going further and further, I realized there's more stuff that we do as dentists just to repair teeth that might be a chronic health killer in the long run. For example, root canals I discovered are chronic triggers oftentimes for patients that don't even know about it, or hidden jawbone inflammation. So it took me a couple of years to understand everything. And basically, I learned from as many good doctors in whatever field. I'm a functional medicine practitioner, I'm a naturopath. I did a lot of extra certifications to kind of develop the doctor I would have needed when I was 20 years old, because it wasn't existing. There was no YouTube, there was no Dr. Google 20 years ago. So I'm just an early biohacker. That's why obviously my friends like Tim Gray, who has the Health Optimization Summit, adopted me as one of the OGs. So now, 15 years later, it's a complete concept. It's called Biodentistry 3.0. And it's, in my opinion, just the evolution of conventional dentistry, the next level. It is the overlap of the high-tech dentistry, the craftsmanship, with functional medicine and, let's say, health optimization / biohacking, with a single one goal to get patients to optimal health by starting in the mouth.
Yeah. I love that. Great
That's
explanation.
great.
Yeah.
Yeah. I mean, biological dentistry and holistic dentistry, it makes so much sense. It still blows my mind that people aren't connecting the two? Like what, and most people have had dental work, right? Like I don't think I've met anyone that hasn't had some sort of dental work, even if it's just like a filling or whatever. Like we've all had some kind of insult. So I'm curious, what kind of health issues do you see a lot in patients that have had all sorts of dental work, root canals, cavitations? What are the big health complaints?
Yes. So basically, we are living in a world of where chronic disease is the epidemic. It's not the pandemics, it's other things. So the usual suspects are skin issues, mental health issues, thyroid issues, gut issues, hormonal imbalances, fertility issues, you name it. Like there's a list of widespread chronic things that are really not covered in regular medicine. Regular medicine is very good for emergency treatments, but we're not so good with dealing with chronic things. And like I already said, the missing link to optimal health is the oral cavity, because like you just said, most patients had dental repair, and it's just depends on your individual immune system. If you can tolerate foreign bodies, foreign materials, metals, or even root canals, which is basically dead body parts. And if you have an immune system, your immune system will react. Your nervous system will get into chronic stress mode. And we know that stress is killer number one. And having dental repair is oftentimes just one of these chronic stressors. But it's not just something outside, it's in your nervous system. Your teeth are an extension of your brain, teeny tiny organs connected to your brain with the trigeminal nerve. And whatever you do there via dental repair will be transported locally, obviously with the saliva, but also through the root, through the nerve system, the lymph supply, and the blood supply, obviously, into the whole system. So you could say, I wouldn't say that the cause for everything is dental health. I would say it's a huge contributing factor. And oftentimes, one of the health killers are lurking in your mouth and you don't even know about it, especially in the world of biohacking and health optimization. If you already do everything and you still feel not superhuman, then it is time to look for these hidden things. And therefore, I would say 10 years ago or at the beginning, I would have seen mainly extremely sick patients, like end station, like Parkinson's, Alzheimer's, cancer patients. They needed to get this sorted to just start the healing process. But these days, I have a lot of patients flying in like that are just like us, health enthusiasts. They just want to have the extra edge, or they know that they have a little bit of a nagging issue, a little bit of a joint problem, or let's say skin issues. That's a big one. Skin problems, because it's related to the gut. The gut starts in the mouth. And therefore, I would say it shifted a little bit towards health enthusiasts, a lot of athletes, and yeah, just people that are interested in investing in optimal health. And I'm actually loving it, because only having super sick patients isn't too fulfilling, to be honest. And this bit is way more fulfilling, because most patients are like you, just friends coming over. And I always say they are part of whoever makes it to my chair. They are part of the big mission, which is helping to reach as many people, to give them the information that maybe something is missing and we need to change. And this is my single goal, obviously, to change how actually medicine is done, and so that they finally see this is all connected.
Yeah, we love your mission. And thank you so much for that clarification. I think that's important, that we don't always necessarily have to run right away and get everything pulled out of our mouths. But if you are stuck on this health journey, it is definitely worth looking at. And then, there's another category of biohackers where it's like, we probably want to optimize, even if we're not symptomatic, but it is so highly connected. And I would like to hear a little bit more about the biological definition. A lot of this is like the compatibility with the mouth. Is there anything else you would fill in that definition?
Yeah, so with the high-tech dentistry part is mainly about using material that is qualified as a biomaterial, meaning it's basically neutral to the body, doesn't cause any inflammation or toxicity, which a lot of the materials actually do that we use. And then what we also obviously implement is nutritional strategies, lifestyle interventions, basically everything from the world of health optimization and biohacking. So this is my Optimal Health Lounge here in the backyard of the clinic, where we have the hyperbaric chamber. There's lots of IVs going on, in saunas, like basically everything we could do to just help patients heal faster, recover faster, because usually we do everything in one go. Like if you present yourself like remotely. Most patients come in from all over the world, so they have to send in the panoramic X-ray, which is a two-dimensional a shot X-ray of your situation. And then we do a planning, a treatment plan, and evaluate what we need to do. And usually, obviously, our goal is to get rid of everything that you cannot biohack your way around, yeah, which is the stuff that is installed by a dentist. Meaning, we remove all metals safely. We take out all root canals because they're usually chronically infected. And if you want to optimize, we look at this different way. We replace them with ceramic implants immediately. And we also take care of these hidden jawbone cavitations in layman's terms that are chronic silent inflammation in your jawbone, usually after wisdom tooth extraction, that are not even taught in dental school. So it is an all-in-one concept where we basically call it a health optimization week. It's quite charming because it's all done in a week. It's prepared, so you know exactly what nutrition to follow, which supplements to take. So you're coming in as a patient very much boosted already. So not in hibernation mode, but in really anabolic state. And then because we have all the facilities here, you will have IVs, hyperbaric, everything that you can, plus a very minimal invasive surgical protocol or dental protocol, because we're actually only here to help your body heal itself. And in order to do so, we basically have to take out a couple of splinters that are ingrown hair or whatever. And in this case, root canals, for example, or the inflammation. And it's insane how fast people heal overall. So I'm now working on including a new device, which is like a real-time VNS or a central nervous system device, like HRV, but not like on an Aura ring, but way more professional. And you can literally see if you take out that chronic stressor, that this instantly kicks patients into parasympathetic state, where they were, for example, 20 years in sympathetic nervous system, couldn't sleep, no deep sleep, no REM sleep. They hacked everything, but still no sleep. It might have just been the metal in their mouth or the titanium implant, which is an antenna, and disrupting their complete nervous system. So this is how we did it for Chris. Yeah, Chris had a lot of stuff done, and he is obviously extremely optimized.
Yeah.
And then at one point he had the time to do this, and he said it's like amazing what changed ever since.
Yeah.
I'm sure that resonates. A lot of people are like, how do I get my HRV up? Well, we're missing something.
Exactly.
We're missing something.
And the problem with the HRV, especially in the biohacking world, is that we all have like such a ring here. Like this is not an Aura, but kind of like an Aura. I have tested all of them, the Whoop, the Aura, because so many patients have it. So I have to know exactly what we're talking. And I'm hacking always myself and tracking and doing these things. And I realized with these data here, everyone is just like, oh, I need a higher HRV, which is complete nonsense. We need resilience. And the Aura ring doesn't realize what is the good part or bad part. It just gives you, okay, good, high HRV, low heart rate is good. Is not good, because it could be that you have a chronic infection or chronic inflammation in your gut or in your mouth, and your parasympathetic kicks in just to help you. Or you're an athlete preparing for a bodybuilding show and you're extremely depleted. You will have a heart rate of 33 and your HRV is probably double. But this only means your body is in like the end stage, and parasympathetic just helps against all that stress, and your adrenals are basically burned out. So this is totally different to medical HRV measurements and stuff that are really like precise.
I'm so glad you said that. I'm so glad you said that, because Lauren and I actually, we naturally have higher HRVs, but like I've had my fair share of health issues, but people are like, oh, your HRV is so amazing. And I'm like,
how high is it?
My average is like 150. But
okay.
Yeah, but I'm so glad you said that, because people misunderstand.
Mine's around 100 average.
So the way how I see it is there's different types of persons. So there's very sympathetic dominant person that I would say the average Aura, let's say an Aura or Whoop HRV, a nighttime average would be 0 to or 20 to 40 milliseconds. Then there's like those are more the ectomorphic person, more stressed, more adrenal thing. Then the next is basically a mesomorph person. A balanced body type is, I would say, 50 to 80, 90. And then there are true parasympathetic dominant people like yourself, for whatever reason. You're just having a high rate, let's say above 90. Some people have 220. But if I would have a 220, because you have to just know where is your set go? What is your ideal? And then okay, now I have
Yeah.
a virus, so it tanks. Okay, now I'm in chronic stress, it goes up. So for me, the same. So I'm like at 50 because I'm a very balanced mesomorph body type. And if I get super stressed from a virus, it can tank to 10 and my heart rate goes up to 80, which is normally 35. And then if I'm very like stressed or long-term chronically depleted for whatever reason, low calorie deficit, whatever, then it will go to 90, 100 HRV and my heart rate even dropped to 30 once. So
Wow.
but then I know it's like, I'm stretching the limit here. So
Yeah.
you have to just
Yeah.
know how you individualize it. And I always do this in level 3 for our nutritional designing, which is basically the food design concept I'm teaching, which is a lot in biodentistry, is about nutrition and supplementation and all these things. This is one of my specialties. And food design basically means patients learn how to think in nutrients. And step 1 is always removing all the crap foods. Step 2 is learn how to think in macronutrients. And in step 3, when patients are in here, I will always see their data, for example, that ring, and tell them exactly what I did tell you right now, because I see true sympathetic dominant, true parasympathetic, they need a little bit of a difference when it comes to energy nutrients. If it's normal, like usually the higher sympathetic side needs a little bit more carbohydrates, easier to digest foods, whereas the other side can do more fasting and eat more bigger meals and more meaty stuff and let's say more fatty stuff. I don't know if that is true for you guys, because I don't know all of you, but this is
that
what
makes
I would
sense.
usually recommend for someone like you. I don't know, I can just guess that you might get tired in the morning if you eat too much carbohydrates, versus eating eggs and steak is probably fine for you in the morning.
Yeah.
Exactly. And
Yeah.
but there are other people need their carbohydrates just as a yin, because they're so sympathetic, they're so adreneric that they just push too hard. And the problem is, in the realm of biohacking, and I see this with tons of patients in that world, we are all high achievers. It's a lot of men actually. And we try to like do fasting, keto, and basically what we do is we push even more adrenaline. So we burn the candle on both ends. And sometimes we need to just think a little bit back and see, okay, how can we incorporate a little bit of yin in our life? And sometimes it's just carbohydrates. But by then I don't mean necessarily vegetables. I really mean like easy stuff like root, tubers, sweet potatoes, white rice. It helps to balance it out. So this is just a little fine tuning, how you could use your central nervous system to fine tune your nutrition. But it's level 3. So
that's awesome.
That.
Yeah.
It's so bio-individual, and also it like fits in with our show perfectly. It's like we're supporting our body's natural healing abilities, but
exactly
the data is important in understanding these patterns. So cool that you're integrating all of that.
Yeah, all of it.
Back to our mouth. We have so many questions for you, but I would love to start with metals, because you've already mentioned safe removal. So a lot of people are getting turned on to the toxicity of mercury from our food supply, but from the metals in our mouths. So people know about mercury, but we shouldn't be running and just getting them pulled out. And also I want to hear about other metals that maybe are being replaced in the mouth.
Yes, so mercury is a special thing because it's super toxic. We know that it's the most toxic non-radioactive element known to men. For whatever reason, we have put that in that dental amalgam. I know for what reason, because it's easy to work with it, and it's old, it's 200 years old, it works, disinfects everything, it's subsidized by insurance companies. That's the main issue. So, but I didn't want to have like something that I have to remove as highly toxic waste from the clinic. How can I place it in the mouth of a patient? This is not logical thinking. So this is why I thought,
it becomes safe once it's in the mouth, right?
Exactly. Suddenly it's safe once in the mouth, but it's super toxic as soon as you remove it.
So
it's
crazy.
Really, it's insane. And up until 2018 in the US, it was labeled as silver fillings, and which is not allowed anymore ever since the Myanmar Convention back in the day. Now they have to call it silver amalgam filling. Yeah, like you just said, you don't run to any dentist straight away and say, oh, I have these silver black fillings, and Dr. Thomas said they're unhealthy and they gas out toxins. They do on a low dose, but the main issue is removing them unsafely, because if you remove them in a conventional dentistry way, we just drill that out without even thinking about it. The drilling will spread way more of that mercury vapor in comparison to just keeping that filling in you. So therefore, what we need to
Mhm.
do as biodentists is we have to know how to remove metals safely so that we don't get more exposure than we had before. Basically, how is it possible to, like, let's say, reduce 99% of all the vapor and things, because the mercury vapor is actually the problem. For example, if you have that
Right.
fillings just by biting, grinding, chewing, acidic foods, oral hygiene, brushing, you
Hot
release
coffee.
you release a certain amount of heavy, even phone calls with a cell phone release
Oh,
more mercury
EMFs.
vapor
Yeah.
because of the EMFs. It's just a tiny amount. It's like 3 to 4 micron per day per filling, but this adds up to becoming chronically intoxicated. So mercury fillings are still the #1 source of mercury toxicity in the human body. It's not the mercury from the fish you consume, because the fish already has it methylated and stored in the tissue. It's not as highly reactive as that vapor that comes out. Vapor is HC0, which then goes into your cell. There's basically no protection, and it also gets for specific enzymes, catalases can reduce it to Hg2 plus, and then store it in the tissue for, and I think the half-life is about 16 to 32 years, depending on your detoxification ability. So this is a special thing. Always need to, don't freak out, always find someone who's certified to remove amalgam safely. And in the US, like besides my biodentistry course, you can get SMART certified, S-M-A-R-T, probably your dad is.
Mhm.
And from the IAOMT, that means Safe Mercury Amalgam Removal Technique. And these, if you Google these dentists, I'm not saying they are always 100% the biodentist that I define biodentistry to, but there is no label, but they will at least remove your metals safely. So that's the toxicity part of metals. But there's 2 more challenges. We also have an immune system. So there's always an immunological component to any sort of metal, because your body can become allergic to it. We know that we can even build antibodies against gold, even against mercury. And there's studies showing with a lymphocyte transformation test, that's how we measure the immune system against various metals. The main allergy component is usually nickel. Yeah, oftentimes it shouldn't be allowed, but it's still in dental material. But then second and third is organic and inorganic mercury, and number 4 is already gold. And a lot of patients still have gold fillings, gold partial crowns, metal fused crowns. So it looks white and looks like ceramic, but underneath it's still metal. So you can become allergic to this. And obviously, because we're having a saliva, it's kind of like the water in the sea is an electrolyte. Imagine a propeller of a boat underneath the water. It will rust over time. So these ions dissolve and go into your system. They're not in your mouth. They're in your whole body. So again, it is a stress on your immune system. And number 3 is the part that is always the woo-woo side of things in medical world, not in biohacking, unfortunately, is the EMFs. We have EMFs everywhere. 3G, 4G, 5G, radar, various different frequencies we're using. And any single metal is an antenna. So even your titanium implant could become an antenna, or the gold filling, or that mercury vapor. So this is really something that is not taught in dentistry. This is also something where you wouldn't find dental research about, but you find it in like microbiology, or let's say in a physics paper or whatever. You have to look at all sciences, not just dental research. Dental research is usually sponsored by the industry and is not necessarily interested in optimal health. It's more about let's say it's more about the craftsman stuff, like a root canal research done from an endodontologist or from like a department of endodontology, means people that do root canals for a living. That's the specialty, endodontology. So they obviously look to find stuff that supports a root canal. Why not? It's normal. Like you could always read it both ways. But I'm just looking different. So we're not touching root canals yet, but just saying, EMFs is not woo-woo. It is the cigarette smoke of the 21st century. It is just, it will just take another 20 years until everyone understands it. And then it's a bit late.
Mm.
Yeah.
There's
Yeah.
always some people that
Far
have to warn a
behind.
little bit earlier. But there is
Yeah.
a disease called, on a symptom, it's called electrohypersensitivity. And there are many, many people suffering from it. And it's oftentimes obviously connected to something in the mouth and they don't even know about it. So what we do is just help the patient and the body really heal, because dental repair is something you cannot biohack your way around. It's not possible. It's the only thing you have to see someone for. And therefore, obviously, we need the right skilled people to do so. So that's
Right.
really,
Yeah.
These foreign things in our mouth. And yeah, the metals
yeah.
are a huge, huge issue. And I have to ask you a somewhat personal question. So I'll tell you,
Yes.
I had a bad accident about 20 years ago. And it was right after our dad stopped doing root canals. It was when he was unpacking all the research. And with my accident, a traditional dentist would have said, we're going to do 2 root canals. My dad said, we're not doing that, extracted them, let it heal. 1 year later, this is in 2005, I got 2 titanium implants because we didn't have zirconia. We didn't have ceramic in the US at the time because the US is always behind. I guess Germany probably had it back then, but I did get 2 titanium implants. So now, and my dad and I have talked about this a lot, I want to get them out and replaced. But what are your thoughts on that? Because I know it's going to be a pretty intense surgery because those implants are in the bone. No, you're like,
Yeah.
easy, just take them out.
Not easy to take them out. It's like, for me, it is easy to take them out because it's something I do on a daily basis. And I have done
Okay.
1,000 times. But I would say
Okay.
like only 0.1% of all dentists place ceramic implants. And of those
Wow.
few, I have placed more than 5,000. So I'm like in the top range when it comes to the craftsman stuff. So for me, it is just normal. It's second nature. But I would say
Yeah.
99.9% of all the dentists will tell you you're crazy. Are you
Yep.
crazy? These implants are stable in your mouth. They're perfectly
Yeah.
fine in your bone. Never
Yep.
do that. And it's an immense surgery because you have to take all the bone away. Not correct. We just take it out basically like a root, clean everything, disinfect everything with ozone, use PRP, and then if possible, if there's enough bone and all is good and it's bleeding well, place an immediate ceramic implant and you're good to go. It's basically just, it sounds bad, but it's basically like changing a tire or like a wheel from
Yeah.
summer to winter. It's just the next set. And
Okay. That makes me
like
feel a
for
lot
you,
better.
it is definitely a contributing factor to whatever symptom you might experience. Could just be some sort of stress, some sort of inflammation, joint things. Which parts of your mouth is the titanium implant?
These 2. So
Which
12
one?
and I think 12 and 13.
You
Can
mean the
see it.
premolars? Right behind
Yeah.
your canine?
Yep. Right behind my
Okay, yeah,
canine.
so first and second premolar.
Yeah.
Yeah, they're directly connected to your large intestine, lung meridian. So immune system could be compromised. Also, large intestine is directly connected to your hamstrings.
Oh,
Some
I didn't
people
know.
store a bit more body fat in their lower body because of these things. Gut health is a little bit of an issue. Could be connected to everything. It's
Yeah.
also connected
I
to the
want to get them
thyroid.
out. I want to get them out because I want to
It just comes here.
thrive.
It's easy. Just fly in, we do it. Yeah. You have
Okay.
to have someone who knows how to do it
Yeah.
and
So
doesn't cause any trauma. It's not traumatic. It's just taking it out. Not a big
Yeah.
trauma. And again, probably 99% of all dentists that hear that right now think it's crazy. But it's not. It's
yeah.
completely okay. You just have to know how.
Why are so many still using titanium? Just because that's the
Oh,
old way of
This
doing
is,
things?
no, I mean, gold this is the gold standard. 99.7% of all dentists worldwide only use titanium. They don't even know about ceramic implants. In Germany, it is, I think the current data is about 6 to 8% of the dentists using ceramic implants, which is quite high in Germany. But in the overall world, it's like nothing. No one knows about it. And they will all tell you it will break. They don't heal. They don't osseointegrate. They don't work. They just don't have any idea. They just don't know. But so I was criticized heavily for all these things. Tons of shitstorms. But ever since 2023, research was on my side because it became medical guideline, the highest S1 medical guideline in German universities. So we have to tell patients that there is an alternative to titanium, which is ceramic. And on top of that,
Good.
they also qualified ceramic zirconia implants as a biomaterial, meaning it's completely neutral to the body. That's what it is. It's just a healing device. It's just a tool for me. Versus the titanium, which is qualified as a foreign body, which always causes chronic inflammation. You will always find higher cytokines, let's say the innate immune cytokines like TNF alpha, IL-1, IL-B, IL-B, NF-kappa B. They're usually elevated because of this. But no one connects it.
Wow.
They're like, yeah, you have a high CRP or high, but it's never connected to your mouth. It is, obviously, it's part of your body. Yeah. Why
Part of your
wouldn't it
body.
be?
Yeah.
I remember like till this
Yeah.
day, 20 years ago, when I started dentistry with that surgeon, there was one woman, she had like a massive periodontitis, huge inflammation in her mouth, and she had high CRP. And she was asking me as like new from university, do you think it could be possible that this inflammation will cause that elevated blood work? And I'm like, yeah, I think so. Why not? That makes perfect sense. Then my boss comes in and says, no, that's complete nonsense. It cannot be connected, and that's it. So that's how it usually works. Yeah, because there's no
Yeah.
connection. But the
Oh my
mouth
gosh.
body connection is huge.
Yeah.
This is a part of your brain. Look at the anatomy. This is an extension. It's like your eyes and your nose. And whatever you do there is extremely important for your central nervous system, sympathetic, parasympathetic, and your immune system and your hormone systems all connected. It's not like you have something on your arm. Like the body is not interested in your extremities. You can lose them if somebody does a surgery, it's fine. But this one is your brain. It's completely different. And there are studies showing that, and this is from the 20s, when they put like toxic mercury fillings into teeth of dogs, and within a day found mercury in the hypothalamus, in the pituitary, in ganglia, and obviously disrupts everything. There's also good studies showing for dentists out there that we are the ones with the highest mercury levels, especially in our pituitary. And that's really bad.
And
because the
high suicide
pituitary-
rate. High suicide rate.
Yeah, highest suicide rate, I think, is always second or first place in comparison to, like, I think it's pilots and what is it?
I've heard lawyers, dentists and
lawyers also. Yeah,
high
and
suicide
pilots.
rate and
And,
pilots.
yeah, and
Okay.
obviously psychologists. So the top 5 usually. The highest suicide rate, definitely. And it's a lot connected to the toxicity of the stuff that we as dentists work with. Because maybe you as a patient get your amalgam filling drilled out once, but there was times when I was protecting all the patients, but not me, because I didn't know. So I was inhaling all that fumes and intoxicated me like crazy. So I had like the highest mercury reading ever. And this was just from being a dentist. And I realized, luckily, quite soon, like before I was 30, that there's something wrong and I have to change. But some dentists, as you know, they're like 50, 60, 70, and it's a whole lifetime of mercury exposure. Obviously, it changes.
Pretty
You know
scary.
that Mad Hatters? Have you heard of the Mad Hatter disease?
Oh
Yeah.
Mad Hatters worked with mercury to
Right.
do the head stuff, and they all got crazy. So maybe a few dentists out there are Mad Hatters.
Yeah,
Yeah.
absolutely.
There's a lot of those.
Yeah, I remember my dad told me they used to bring home mercury from dental school and like play with it. He would like have it in his hands. It's insane. No one would do that now.
No, till this day in university, even in my hometown where I studied 20 years ago, they still learn mercury fillings and they still do it with their hands, because obviously all the dentists, the dental students, they're just having fun. Like I myself was like, oh wow, that's that silver stuff. Nice. Feels good and stuff. Yeah. No one knows.
Oh my gosh. It's like
everyone knows, but
no.
it's insane. Yeah, it's like,
But
oh, nice Play-Doh.
And you break a thermometer at home, the ones with mercury, and it's immediately like a hazmat situation. It's like, why is that different?
I don't know.
Yeah.
It's really schizophrenic. So in dental school, we learn physics, chemistry, biochemistry. We study normal medicine. So we all have to do all the sciences. But we maybe learn in university in physics in the morning that you shouldn't put different materials or different metals right next to each other, because there could be a galvanic element, like a battery, especially if there's also saliva, like an electrolyte. But then in the evening, you go in dental in the clinic and you place a gold crown right next to an amalgam filling. So it's not even connected. And usually, obviously, you know how it is if you're a student. it's more about passing exams. You're not necessarily like passionate about chemistry. I was passionate about chemistry and biochemistry because I had to, because of the interest that I had already in me, in my health optimization journey back in there, because I had to do that. So for me, I loved to learn that and I understood it, but I knew that most of my friends hated it. And they was just like, okay, I have the examination. This is something from the past. I will never, ever go there again. So they don't have that knowledge. They have no idea about nutrition. You don't learn nutrition in university as a dentist or in medicine. It's just not taught. But food is medicine. It's like the main thing to help your body heal. That's the 80%.
Yeah. Same as
Yeah.
medical doctors here. They get like one quick lesson on nutrition, but yeah,
it's probably
a
just
lot.
how to calculate calories or something.
Oh
Yeah.
gosh. Oh, it's
Maybe
very
stuff
sad.
like this. Yeah.
So I want to pick your brain about cavitations, which I think a lot of
Yes.
people don't know about. And you already mentioned that
Yeah.
a lot of this stems from having wisdom teeth taken out, which is super popular. Like people just do it left and right because our
Yeah.
jaws are very crowded. And we could talk about Weston A. Price and maybe a rabbit hole. But tell us, what is a cavitation? What are the dangers here? And like, how do you approach this? Because it's a kind of a big protocol and ways to support it.
Yeah. So a cavitation is the layman's word for something we call FDOJ or NICO. FDOJ stands for fatty degenerative osteonecrotic jawbone. That's basically what it is. It's just fatty, mushy bone that should be sponges. And this is basically can develop after any sort of extraction. But the teeth that are extracted the most in conventional dentistry are obviously the wisdom teeth, especially in the Western world. Yes, we could go down the Western price rabbit hole because we know that indigenous people who eat a regular diet had perfectly shaped teeth and health and space for them and no crowding. But as soon as they got connected to processed foods, which we are doing in the Western world, they grew narrower, they had more crowded teeth, mouth breathing, gingivitis, tooth decay, looked like little monsters. 100 years ago, he realized that.
Yeah.
But the problem is, our teenagers still look like that because they all need braces. They take their wisdom teeth out because we just grow too narrow. And this is what dentistry should move towards too, that we teach parents, ideally before they even get pregnant, the women, how to support the body, how to prepare the body for pregnancy, to be in a surplus of nutrients, how to, like, which nutrients are very important in which triamine so that the baby is supported very well and the teeth development, and then teach them how to breastfeed. And that breastfeeding is something important, if possible. I know some women out there cannot, I'm sorry about that, but it's supernatural. If you can do it, do it. And because that's the first orthodontic treatment for your kid. And if you're having good breast milk because you have a good lifestyle and you detox your body before you become pregnant, then it's like the best cream you could feed your baby to grow. It has everything in there and it builds the whole immune system. And because of the sucking on that nipple or on that breast, you need 10 times more strength than sucking on a baby bottle. And this will grow your jaw forward. And at the same time, you have to breathe through your nose, widening your palate. So if you do that for like 18 months at least, it's the first start. And then obviously what you feed afterwards will basically determine how your body grows. And usually we grow too narrow. We don't have space for 32 teeth anymore. Actually, there was times when we had 36 teeth. So more than 10,000 years ago. Yeah, before all the agriculture started, because we just ate harder foods. Yeah, way more bigger jaws. And still people to these days, patients, have the dental bud, the germ, so to speak, for the second wisdom teeth, which oftentimes are cavitations, to be honest, because if you have a dental bud that doesn't develop into a tooth, happens a lot also with the first wisdom teeth, this tissue isn't supposed to be in the bone. So the tissue can become fatty and osteonecrotic again. So this could be a cavitation, not from extraction, but from previous teeth that didn't come out. Like, I don't know the word right now in English. If you miss a tooth hereditally, yeah, it's often like it's very common, to be honest.
Wow.
And this is like, because I'm a surgeon, I realized, okay, I could do this surgery and remove obviously that crap bone, but if you don't understand why it develops, it will just develop again. So doing a surgery, again, will just lead to the same outcome. Why? Because a cavitation is basically just a sign for a poorly prepared body being in a depleted state, being catabolic, and wasn't able to build. And especially because we take out wisdom teeth in teenage years, usually in puberty, when they're still growing. The body uses all that material to grow for the body, not to heal something here. And usually the dentist will only tell you about the informed consent will only be, we have local swelling, you need to apply cold, you need to take ibuprofen, painkillers, and antibiotics. That's it. There's no systemic preparation. And this is obviously what we changed. And this is my main teaching, is how to prepare patients to be anabolic in a surplus, so that if we have to do that wisdom tooth surgery, we make sure that it will develop solid bone afterwards, because the body is able to build tissue. We just need to bring it to make that body anabolic. And there's nothing to do with steroids. It just means your body can build tissue. And obviously we use everything that's possible. And this is systemic bone healing, systemic bone growth. And it has to do with a lot of nutrients, macro proteins, amino acids, all these things, and micronutrients. And this is why I've developed a bone healing protocol 10 years ago, which focuses on all the biochemistry on how to build bone, funny enough, and teeth, because you can rebuild teeth too. Not to full extent, but if it's initial tooth decay, you can definitely rebuild it and don't need to drill. But it's something we don't learn in university.
No,
Yeah,
no.
pretty wild.
And how do you test for cavitations? I know there's like the cone beam, cavitat.
Yeah, so,
what do you like to do?
Yeah, that is the gold standard. We also, on top of a cone beam, so the cone beam scan is a 3-dimensional X-ray, where if you know that the cavitation exists, this is the first thing you have to know. A lot of surgeons out there who have a cone beam in the clinic don't know about cavitations, so they will not diagnose because they just don't know. So you have to first know it, and then it's super simple to see it on a cone beam. You can actually also already spot it on a panoramic, or at least what we do in a preliminary treatment plan is suppose or assume that there are cavitations because the wisdom teeth are missing. If it's not that case, if we do that cone beam later on when patients coming in, then it's this way. Then we don't do a surgery, obviously. But usually in 95% or more, there is a solid cavitation, and we have to approach it and repair it. And it's also, again, a super, super minimal invasive surgery. If you know how to, you can do that completely scar-free. We use piezo surgery. We draw blood before, we spin it, we make PRP. We use a lot of ozone, neural therapy, and obviously the IVs, the hyperbaric, and the right nutrition and nutrients, like way ahead, like 4 to 6 weeks prior. And then to the next 3 to 4 months, patients know exactly how to eat and what to do. And they are not just healing in their new implants and healing their bone. They also heal the complete gut system. They heal the complete matrix. So this is why a lot of the health issues from patients, they tell you, okay, I've seen 29 doctors. I have this, and this diagnosis. And now 1 day after surgery, 80% is already gone. And then if they see you again 3 months, 4 months later for the crown work, for the prosthetics, the aesthetic part, and the teeth that you see, then they usually lost 20 pounds on top of it. Just as a side note, just as you know, if people are not optimized, if you just optimize your lifestyle and nutrition, you get lean and aesthetic because it's just a natural way.
Yeah.
You don't need to.
Toxicity is stored in fat cells, and the body holds to keep you safe.
Yeah. And it's all connected. There's like an osmotic system here. Means the more toxins you have in your cell, the more is in your body, and they will be hard. And especially if there's heavy metals or the root canals and stuff, like root canals is the same.
Yeah, root canals.
Are you using ultrasound to confirm the level of infection, or do you feel pretty confident?
We have a Cavitao ultrasound, which we use mostly not to confirm the initial cavitation, because you can actually really see it on a cone beam. But what we use it for is mainly if we suspect recurrences, if something didn't heal, or even on and around implants. Is because a ceramic implant, for example, it scatters. If you do a panoramic X-ray afterwards or a cone beam, you will never see bone around it because it will just be black. This is just because the radiation can't go through that ceramic implant. It just scatters and it's not possible to see. There we can use a Cavitao, the ultrasound, to see, is the bone around that implant really bone? And that's a good device for this. But to initially diagnose, you just have to have a biodentist who knows I call the biodentists the real bees, the real biodentists. That's my tribe. They know.
I love it.
They had
The real
they
bees.
also always had it done on themselves because they need to
Mm.
practice what they preach. They know how it feels and they can guide their patients through that surgery and tell them what they need to feel inside while doing the surgery.
Yeah.
That's the amazing part.
That's great. Great
Because you
point.
will feel if
Yeah.
you're not in your mind, but you feel like basically you give the mouth, like you give the responsibility to my side, I'll do the work, and then you feel from here downwards. You might feel that you can suddenly breathe deeper. Sometimes people start to cry for no reason because the parasympathetic system kicks in and they release their trauma. They start shaking. Looks like exorcism, but it's just normal. And it involves a lot of psychology too, to help patients because teeth and trauma in your body always stores emotional trauma too. It's kind of like an external hard drive. And if you take it out, maybe pictures come up or old patterns or stuff that you had like swallowed for years. You know what I mean? It's oftentimes stored in trauma, for example, in these cavitations. Also in the US, what's big in your side is mold. You have a lot of mold issues. So you have a lot of patients coming in with mold issues. And what we found is there's a ton of mold spores living in these cavitations. And as long as they are in there, they will never get rid of their mold toxicity. Whatever protocol they do, it's not possible. You have to remove the source first. Then the body heals. Super simple.
And I don't know about over there. We see a lot of Lyme here as well. And our dad sees a lot of Lyme patients, and it's like resolving the cavitation or the root canals was like the final thing. And now they can actually fight the Lyme and clear it.
Yes, exactly. And it shouldn't be the final thing. It should actually be a foundational first thing, because then they don't suffer for years and years and years, because that imbalanced ecosystem that happens because of dental repair, like metals, root canals, cavitations, is the perfect ecosystem for Lyme. So therefore, we have to remove it because the natural ecosystem is not good for them. So it's actually just to have to reverse it. And yeah, it's just an epigenetic issue.
Yeah.
So therefore,
anytime there's stress and toxicity.
I'm not healing. I'm helping the patient to heal by taking all the other stuff. Yeah.
Yeah. Removing the source, removing the stressor and the toxicity. So huge. Yeah.
It is.
The interference.
So big. It's so big. And finally people are waking up. So, but it takes so much effort. Like I'm on that journey for 20 years. I wrote a book about it in 2019, and a ton of shitstorm yeah, you have it. It's all in your, I see
it's exploding. Put it right in front of your face.
Because you have that background. Yeah, it's cool. Thanks. And yeah, like you cannot imagine how much shit you get for this at that time.
Sure.
In hindsight is amazing because, as you know, they either hate you or love you. So I'm the biggest conspiracy theorist in whole dental world anyways, so I can say what I want. The good part is, I'm just kidding. The good part is that we're also extremely scientific, and I'm also the vice president of the International Society for Ceramic Implants. We do a ton of research, and we are practically speaking extremely good with what we're doing. So they're having a hard time to criticize us, because now, 5 years ago, my stuff wasn't accepted. Now it is. So now they all come. They're like, oh, maybe he was right in the first place. Maybe an immediate ceramic implant is a good strategy. Maybe you not telling this to your patient will be a problem in the future, because we now know from research that putting an immediate implant after taking out a root canal keeps the bone and anatomy alive. You don't lose bone. Versus when you just take out a tooth and wait, you always have alveolar atrophy, which means the bone collapses. And this is actually hurting people, because then we need a bone graft, need longer time. So this is where you get criticized for stuff that you change, because obviously change is the biggest enemy of every human. We're all a bit afraid of change.
We don't like it.
But I love it. Like I'm always curious to see new things. Like I don't say that whatever I do is the best thing. I just say that this right now good. And we always look for new, better things. So I'm always happy to change completely. If there's something better, why not?
Yeah. And if people are hating on you, it's because you're doing something right, I think, right? It's like more hate mail. It's like, oh, you're shaking things up. There must be something to this. It's good.
Yeah. You have to learn this the hard way, but then at one point you understand, okay, there will never be a landslide, which means 50-50. I think it was only once in your whole presidencies that you had a landslide, which means 50% voted for your president. Usually it's like maximum 30%. So 70% still hate the president. So that's fine. Like nobody will ever, everyone will ever like you. That's not possible. And also it's not about me. I don't even care. It's about changing that game because that's needed. We need to help the many that are suffering. And this is why biohacking and health optimization is so cool, because it goes in this direction. Sometimes goes a little bit too deep in rabbit holes and misses a little bit of the foundation, in my opinion. Because it's a kind of like a tribe. And I realized soon, because of Tim, that they all do the same at the beginning. They, like I said, they do keto, they do fasting, they use tons of devices and lots of supplements, but they don't even know how to use the right nutrition first. So they just out-supplement the bad diet and becoming a deficit and are afraid of carbs or whatever. So you know,
Well, thank you for spreading the word. I think it's so important that people do start with the mouth. It's so sad to see these patients that have seen 20 doctors and haven't gotten answers. It's like we need biological dentistry to be the first or at least second stop. So
it needs to be. It needs to be. So ideally, every single health practitioner, doctor, medical doctor, whatever, would incorporate looking at a panoramic X-ray and seeing, oh, there are metals, root canals, cavitations. This is something we have to do within the next 3 months to get this patient to the next level. And this is why I have finally opened that biodentistry 3.0 certification for the open-minded dentists out there, not young and wild necessarily, or also old and wild, but it's globally, it's in English. And the first 2 cohorts are already, so I started this 2024, and the first 2 cohorts are already finished, and they were all internationally. So I think in the first cohort, five of them were in the US and some in Canada. One is in Australia. The one from Australia was the first to also fly in and do everything. So they just have a different mindset. They want to change something. And there are many more coming to the US. So that's
great.
Good.
Any in Maryland? Our dad needs help in Maryland.
Not yet in Maryland.
Okay.
Not yet.
Okay. Not yet.
If there's one in Maryland, connect. And
let us know. Let us know. Oh, I think Lauren her computer was
lost Lauren.
She had to change her battery. Well, before we wrap up, I have one final question for you. What about biohacks for surgery? Like post-surgery, what can we do to heal faster?
Do you mean like when you're in the clinic, or just what you can do at home, for example?
I think more at home. I mean, I guess also in clinic. I know you said like you have IV and
that's what I mean. It's just basically turbocharging everything. But the main thing is your foundation. It's boring, I know, but it is your nutrition. That's the foundation. You have to learn how to think in nutrients. Which macronutrients do you need? So we prescribe the patients 2 grams of protein per kilogram ideal body weight, or it's 1 gram per pound in your language. And because they will anyways do a little bit less. So if they end up having 1.6 instead of 1, it's okay. So they become anabolic, they have the right building blocks. And then obviously I fine tune their energy nutrients based on how they look and how the body composition is. We also scan every single patient on a medical in-body, which is kind of like a DEXA scan, but without the bone density. It's an impedance measurement. So you can see, it's very cool to show patients data. Because then you can show them, hey, your visceral fat is like so high. This brings you down to this and this level. So we have to do this. So they follow the nutrition even more. But super simple speaking, just eat real food. That's it. Ditch the fake food. No gluten, no dairy, conventional dairy. I mean, raw A2 is different. Raw dairy is fine if you can tolerate it. Bad oils, obviously, everyone knows about this. And sugar, typical dental thing, you should avoid. And then focus on real whole foods, and then fine tune maybe your energy nutrients, and then you're good to go. And then on top, all the patients do the right micronutrients. So for me, the macronutrients, the nutrition is the motor, and the fine tuning, the AMG tuning is basically the micronutrients. And the bone healing protocol started with super high doses of vitamin D3, because I realized soon that vitamin D3 is the sun hormone, is critical to bring calcium from the bloodstream and from the intestines from the kidneys and the intestines into the bloodstream. And then we need a couple of cofactors alongside it, like vitamin K2, magnesium, omega-3 fatty acids, zinc, boron, and activated B vitamins to get these calcium from the bloodstream into the teeth, like tooth decay, and into the bone. So basically, tooth decay is just kind of like an osteoporosis of your tooth, just a depletion. And you can, and therefore patients of mine know exactly what to do. And when I have my own supplement company, I had that even before my clinic here in Germany. It's called Subs Nutrition. And this is all based on my teachings and formulations. And it grew with that teachings. So I didn't come into that game for selling a product. It just came organically because I realized, okay, patients need this and this and this. Quality is not controlled. Supplements is like nutrition. You have to just believe what's on it, and I don't trust. So I wanted to incorporate a new standard that is
good.
Basically, back in the day, like 10 years ago, it was difficult to find supplements that are even without magnesium stearate, without any fillers, anything, and basically just a vegan capsule, which was a prebiotic. And every manufacturer was telling me back in the day, that's not possible. It will ruin my machines. It is all possible. You just have to invest the time and thought processes. And this is also a big part of the teachings, because you have to understand micronutrients. And this is also in this lounge here, the Optimal Health Lounge. We have a lot of different IV protocols that I've designed over the years, because this is actually what I love to do, like formulating and nutrition and these sort of things, besides doing surgeries.
Yeah.
So
Very
awesome.
passionate.
Such a comprehensive approach. And we're so grateful for the work that you're doing. Thank you. I personally have a lot more questions, but we do have to wrap up. We're going to share all the resources to find you in our show notes, but can you just tell our audience where they can find you and where they can find the course for dentists?
Yeah, thank you. The easiest way to find me is probably Instagram. It's at Dr. Dom1. And you have it in the show notes. And the course, the biodentistry course, is on the Institute of Biological Dentistry.com. That's just the main domain. So I founded the Institute of Biological Dentistry, and this is where the course is. And yeah, that's it. Yeah,
wonderful.
Shoot all the questions you want. It's fine. We can also connect on WhatsApp, and you send me your panoramic X-ray, and I'm happy to diagnose and send a treatment plan. No problem. That's what I'm here for.
Amazing. Thank you. Yes, definitely go follow him on Instagram. You have amazing content. We can learn so much more, and hopefully we can have you back someday soon.
Always.
Yeah. Wonderful.
Well, before we wrap up, we would love to ask for just one final piece of advice. If there's something that you want to share with our audience, something they can start doing today before they set up their appointment to see a biological dentist, what can they do today?
So what you could do straight away is look at your toothpaste and see if this is a clean, toxic-free toothpaste, for example. Most conventional toothpaste are a scam. They're completely full of crap. They're just chemicals. There's fluoride in it. I'm team no fluoride as a biodentist, because we don't need it. So find something that is without fluoride, without tryptophan, no sodium lauryl sulfate, and basically look for something that is on a coconut oil base, contains hydroxyapatite, contains xylitol maybe, and a few essential things, something that you would eat. This could be a start. And then start tongue scraping. It's something that takes a second or 5 seconds, and coconut oil pulling I would also include. So then you have your bulletproof oral healthcare regimen, and this is something you can literally start tomorrow. And the only thing with it is consistency. You just have to do it. That's it. And
key part, got to be consistent.
It's always the difficult part, I know.
That's easy enough. All right, that's your homework. Check your toothpaste. I love tongue scraping and oil pulling. I'm a huge fan. So
perfect.
That's great. Awesome.
Dr. Dom, thank you so much. This is so wonderful. I want so much more. We always want more, but it's good. It's good leaving everyone wanting more. We'll have you back. We're so grateful for your time.
Thank you.
Yeah.
It was my pleasure, and it was great chatting to you guys. And thanks for your mission too, for sharing all this. And let's spread the word. Optimal health starts in your mouth.
Yes.
It's the missing link to optimal gut health too.
Yes. That's so important. So important. Great. Well, thank you. And thanks to everyone
Thank
that
you.
tuned in today. We will see you next time.